Welcome to today's Bustmob Live. I'm so excited. I get to be the host between these two awesome ladies, Leah and Gianna. I'm excited to introduce them. But I'm Greta Nance, and we are going to talk today about something I'm super personally excited about, prehabilitation, prehab. Everybody needs to go to prehab. And we're going to help you get prepared before surgery so that your recovery is smoother, it's faster, and it's just a more pleasant experience because that's the no fun part of plastic surgery. So joining me, like I said, is Gianna Molina and Leah Lott from Amelia Health in Raleigh. And let's get started, ladies. Gianna, why don't you tell us a little bit more about what Amelia Health actually is?
Fabulous. Thanks, Greta. We're super excited to be here today. So, Amelia Health is a wellness and longevity practice here in Raleigh. And what we do is we use very comprehensive lab testing to help inform the different kinds of care that we offer. And that includes hormone therapy, peptides, longevity care, weight management, as well as regenerative therapies. And then, in addition to that, a big part of what we do is what we're going to be discussing today, where we help patients get ready and recover from their plastic surgery. So, we saw this as a need and an opportunity to serve patients in a really unique and thoughtful way. And so we're excited to share a little bit about what we do with the Bustmob community, as well as just some things you could do at home. Ways that you can get ready for surgery independently. So, I'm a nurse. I've been a nurse for 8 years. Leah and I are the clinical team here at Amelia Health in Raleigh, and I'm really excited for the Bus Mob community to meet Leah. This is Leah's first Bus Mob Live.
Yes.
Um, for everyone to get to know her and all the fabulous work that she does for our patients here at Amelia Health. So I'm going to hand it over to her and have her introduce herself and let everyone know sort of what she does at Amelia Health and the role that she plays here with our team.
Yeah, so I'm so excited. This is my first Bus Mob Live, so bear with me. I had to move my camera angle like 17 times, but we're
You've
here
nailed
and we're
it.
good.
You've nailed it.
So I'm Leah Lott. I'm a PA. I've been in the functional medicine space for about, I guess, 8.5, 9 years. I do a little bit of aesthetic injectables too. So I've been taking care of women for a really long time. So my focus over the course of those 8.5 to 9 years has just been to optimize women's health. So kind of that space between where your OBGYN and where your primary care. So everyone goes to their primary care and they say, oh, hey, I get these labs every year. They're checking my cholesterol. They're checking my blood counts, but they're not checking my vitamins. They're not checking my hormones, those things. And then you go to your OBGYN and they're like, here's your birth control pill or here's your Mirena. And so I'm kind of in that space in between where I'm going to kind of dive deep into what your hormone health looks like, what your vitamin levels look like on a micronutrient standpoint. So, how your body is using those nutrients. I'm going to look at your gut health. I'm going to look at your thyroid health. I'm going to look at all those things that are kind of in between those two aspects and just dive a little bit deeper and not only make you feel better, but optimize your life for long term. And I think part of that is longevity. We talk about that word a lot. And so, how can we live better for longer? But also, it comes into play with surgical prehabilitation. So, how can we optimize our bodies to be in the right state? Because surgeries are a big deal. Surgeries are a lot. They're a stressful experience, not just mentally on us, but for our bodies physically. And so, how can we kind of prepare our bodies to get to that point? So yeah, I'm excited to meet y'all.
Yeah, this is like my entire algorithm on Instagram or TikTok right now. That might just be me, but I cannot believe it's not other women getting
Yeah,
targeted with you need to eat more protein or try these peptides or try this. So I think this conversation could not be happening at a better time
right.
because it's so overwhelming. And we want to prepare before surgery. We want to shop. I'm like, give me your Amazon list. Like Bus Mob is so good at that kind of stuff, but there are things that we can do for our physical body
Right.
beforehand. So we're going to talk about whether you only have 2 weeks or ideally 3 to 6 months
Yeah.
beforehand. Or hey, maybe you've already had surgery and I'm telling you, you're still going to learn some stuff because I learn from these two ladies every day. So yeah, grab a pen and take some notes. But let's start at the beginning with like, what even is this word prehab? Pre-rehabilitation that gets thrown around. Like Gianna, what do you consider surgical prehab?
Sure. So I think that it is the intentional preparation of your mind and your body before surgery. So, not waiting until after surgery to say, okay, the big day has come and gone. I've spent all this money. I've taken time off from work. I've recruited my friends and family to help me. I'm taking the time it takes to heal and recover. Now, what do I do to make sure this goes well? It's sort of front loading that work so that when the day does come, you know that the days that follow should, in theory, go smoother. And so it's really just putting down this very intentional foundation to cover all of our bases. So that's my take on it. And I'm going to hand it over to Leah so that she can get a little bit more into it as well from a more clinical perspective.
Yeah, so I think prehab, I think definitely there's a mental component to prehab as well. And I think, Bustmob has done a good job about talking about some of those. But I think the fact that like we're even talking about this and thinking about it, like the fact that you're putting it at the forefront of your brain is just already calming down your stress response, that you're already saying like, hey, this is like something I need to think about and do. So I think one like physiological portion of prehab is just stress management. So that's like the very first thing that we can do for our bodies. And so taking control of the situation and kind of knowing like how you're going to manage your stress going in and going out. I think that's one, because stress wreaks havoc on our bodies. We all know that from a day to day. I think inflammation, so making sure your inflammatory markers and system is where it needs to be. So surgery is a very inflammatory process. We need inflammation is what heals us. So we all think inflammation is bad, but controlled inflammation is actually healing. But if we're already at a really inflamed point, then sometimes that is when we can have an over amount of inflammation, and that can lead to side effects or things that we don't want after surgery. So calming down the inflammation. I think nutrition is probably the number one. I think there's two: nutrition and exercise. So nutrition, I think, is probably number one. So what are we feeding our bodies? How do our bodies look like actually on a cellular level of nutrition? So it's not just like, hey, am I getting enough water? Am I getting enough protein? Am I getting enough carbs? But do we actually have the vitamins and nutrients? Are we absorbing those? Do we have enough to prepare our bodies for this extremely stress induced situation that it's about to go through? And then I think, circulation. So exercise does a few things. So one, exercise is going to help build the muscle mass that you need to support your body around the areas that you're healing. But also it helps promote blood flow and circulation. And the more blood flow and circulation that we have going into surgery, the better that those tissues are going to heal. We can't get that inflammation, those inflammatory markers to the area that it needs to heal without blood flow. So circulation and then exercise, like I said, just building muscle mass around the area. Those would be like the top kind of physiologic points that I would say we need to focus on when we're talking about prehab.
Are there certain workouts? Because like I could see somebody, should we do more
Yeah.
cardio, more weights, a
Yeah.
combo of both? I know that's not, you're not a personal trainer or anything,
Yeah.
but
No, I'm
is
not a
there an
personal trainer. I think like so the studies that have been done on this were mostly done on squats. Like actually Gianna and I were talking about, we met with someone else who does a lot of prehab for her surgery patients and like nutrition optimization. And she was talking about just like getting up and down off the toilet, like squatting is like helps. So I think anything that is strength training, anything that is going to help build the muscle mass in your skeletal system kind of around to support, because think about a tummy tuck or a breast dog or both of those together. Like you're using so many muscles in your legs and in your back to help support as you're healing. And if you don't have that, then you're going to put more strain on your body. And so, yeah, the majority of the studies and the research come around lower body exercising. But I
Mhm.
think whatever feels good for you, if that is Pilates, if it's yoga, whatever it is that you're doing, exercise in general is just great. But yeah, focusing more on strength training and lower body is what the studies say.
I think I told you this. I wished right after I got my tummy tuck, I was wishing I would have done more strength training because
Right.
of, yeah, the toilet hovering,
Yeah. Yeah.
with not using your core is really difficult. But by then it was too late. And also, I think mentally knowing I could not lift for 6 weeks, I wish
Right.
I would have like built up,
Yeah.
some muscle beforehand. So
Right.
let's talk about timing then. Like, Leah, what does an ideal timeline look like? Because you ain't building muscle in 1 week.
Right.
But
Yeah.
like,
So I think like the optimal timeline is to like really set yourself up for success would be 3 to 6 months prior to surgery. So that in like a perfect world would be like, okay, hey, I can really start like the exercise regimen that I want to do. I can start optimizing my nutrition. I can possibly meet with Amelia Health, get my labs tested, actually know where I stand. And that's like perfect world scenario. But obviously that doesn't apply to everyone. People, things come up, people get in with Dr. Pyle, last minute. So
Mm-hmm.
people surgeries get moved and you have to do them when it's convenient for you. And so really the studies say that like optimization is really in the 2 weeks before and the 2 weeks after surgery. So if you can exercise and eat right and take the right supplements that you need 2 weeks before and 2 weeks after, that's when it's going to make the most difference. Now, if you've been sitting on your couch for 5 years and you start exercising 2 weeks before, is it going to make a ton of difference? Probably not, but it's better than what you were doing before,
Mm-hmm.
So that's what the studies say. But obviously, in a perfect patient scenario, like I said, 3 to 6 months would be like that kind of sweet spot.
Mm-hmm. Yeah, is that what you agree with, Gianna? Anything else to add to that one?
Yeah, I think the only thing I have to add is that something I have found just from taking care of women is a lot of times we feel like conditions have to be perfect. Like
Right.
we'll make a plan and say,
Mm.
I will do that, but first I have to like get all my ducks in a row.
Yeah.
And I really think that doing one thing is always better than doing nothing. So we don't actually have to achieve these like perfect conditions to get started.
Mhm.
So exactly what she's saying, like if you've never done anything and you're saying, okay, I'm going to start like literally doing air squats, like
Right.
that's awesome. That's great. So you don't have to like join a gym and get a personal chef and hire a house cleaner and
Mhm.
do all of these things and come into Amelia Health to make sure that your surgery like and your recovery goes well. Like these small changes matter, and we're here to help guide you through them and help you
Yeah,
identify them.
Right. And
she's
that like
this.
all sorry, Greta, but like that
Uh-uh.
comes back to the stress management too. Like if like needing to like optimize all these things is causing you more stress, and that's probably doing more harm than good. So yeah, just pick one thing that you're going to do, and like I would say the two things that are the biggest are nutrition and exercise. So if you can do one of those two, if you can really eat right, or if you can exercise, or if you can do both, I think that's like Gianna said, better than nothing at all.
Yeah. Only thing I was going to add is that if we all waited to have plastic surgery when our life was perfect, I never would have ever done any of it, and I
It's
still
like
don't
waiting to have a
regret.
baby.
Yes,
Like never at the
says the
right
pregnant
time.
woman.
Yes, as the pregnant woman. But yeah, no.
No, but let me tell you, squats could help the toilet situation because that was
Yeah.
tough.
Yeah.
But I still would not trade it. And then I started doing squats after, and now I'm all over it. I just dropped all my papers, which I can bend down again. Okay, I love a case study because, of course, I'm mainly trying to get you to diagnose me, but I had to
Right.
fudge the age a little bit. But I think this is really helpful because everybody is so different. So let's do like a real life scenario here.
Yeah.
Let's say we have a 38-ish-year-old woman, around 140 pounds. She's, happy with her weight. But who doesn't always want to lose 5 or 10 pounds?
Right.
And she's going to have a mommy makeover. So, the average mommy makeover is usually a tummy tuck, a breast lift with implants. What are some tactical things she can do to get ready for surgery?
Yeah. So I think on the nutrition aspect, the stuff that has the best research behind it is protein intake. So protein is big. We all are like protein, protein, protein. It's harder. It's like easier said than done. Obviously, if you're trying to meet your protein goals, it's much easier said than done. But for a 140-pound woman, we usually I say around like 1 to 1.5 grams of protein per kilogram. So for someone that's around 140 pounds, that would be somewhere between like 90 to like 110 grams of protein a day. And you can get that in any way. Like different people like different types of protein. Plant-based protein is fine. Protein is protein. Um, I think people can overdo it sometimes with the protein. Going into surgery, that's not really that big of a deal if you overdo it. I think underdoing it is the bigger deal if you underdo it. Your body needs protein to heal. So most of the studies that we have seen with post-op healing have been done on like wound care patients because that's where the money is. They don't care about plastic surgery patients to do the research, but protein is the biggest thing for that. So yeah, so around 1 gram per kilogram that you are in weight, or 1.5. So that is the very first thing that she can do. I think as far as like nutrition is concerned, otherwise, there's a ton of vitamins and like supplements that you could take. And the list could go on and on. Like what the studies say is like you need this much vitamin B and this much vitamin A, and like that's hard to do. Obviously, if you see me, I can get you set up with what you need. But if you eat a variety of fruits and vegetables and protein, you should be getting all those nutrients from your diet itself. We don't need to be taking buckets of supplements to get those. So I would say
Mhm.
eating a variety of fruits and vegetables, hitting your protein, and then the strength training, like we said. So 3 to 4 days a week can be 20 to 30 minutes. You can go on a walk with a ruck vest. That's enough. You can do air squats, like Gianna said. Those are like, you can do Pilates or yoga. Those are all strength. But your body weight is creating strength. So anything body weight related will help. But those would be the things that I would say. And then I
Mhm.
think one of the biggest complaints post surgically is constipation. So a
Mhm.
lot of people talk about constipation. You're going to get antibiotics with most surgeries, and so really setting your gut up for success. So if I had to pick like two supplements for you to take, it would be to start taking a probiotic, because I think that's really important just for moving your gut health, and preparing for those antibiotics that you're going to get. And then magnesium. So magnesium is going to help with everything from how your body's responding to stress, because it'll help you sleep better. When we get better sleep, we heal better. And so it's going to help with sleep, it's going to help with stress, and it's going to help move your bowels. So
Mhm.
I like magnesium glycinate because it does all three of those things. Not all magnesiums are created equal, but magnesium glycinate should give you some help with stress, sleep, and poop. So
Mhm.
that and probiotics, protein. So probiotics, protein, exercise, and magnesium.
Should they continue eating that way for the first few weeks after surgery? Because I cannot imagine trying to get my protein intake the few days
Yeah,
after surgery when you feel like shit and you're wearing a super tight
yeah,
garment and like you
yeah.
do have to adapt a little.
Yeah, I think prehabbing with the protein is the bigger benefit.
Uh,
But yes, I mean, the studies do say that afterwards you should try to hit your protein goals. But I think do what you can. Like, you do
mhm.
not have to be hitting those, 2 days post op, 3 days post op, 5 days post op. But when you're feeling better, you're 7 to 10 days post op, and you're feeling
Mhm.
like you can, focus on that again. I think the earlier you do it, the better as far as healing is concerned. But that's why this is prehab. We're talking about what you can do
Mhm.
on the front end. So I think
Mhm.
that makes more of the difference.
I love it. How about you, Gianna? What do you think?
Yeah, I think the nice thing about prehab is that if you go into surgery with some muscle on board, you sort of are able to use that as a piggy bank, like while you're
Right.
healing. And so even when like that protein goal feels really don't, I mean, post op, you don't feel you're like a rice cake with this pill, so I'm not nauseous. Maybe it's really hard. But when you have some muscle to pull from, your body is able to have what it needs. So think of that muscle mass and that work beforehand, sort of as a piggy bank. And then I really think that what I've noticed is that the patients who feel like they had a pretty enjoyable, doable recovery are the ones who went into it prepared for all the things, including like mentally. So I think that at Amelia, like the clinical team really sets you up, that they really see you through from beginning to end with like your medical needs. And then the Bustmob community provides this community where all of those in between things, the like, is this normal? I'm feeling sad today, like I'm struggling today, I'm having buyer's remorse today. Like all of these things are real, and they're not things that you should like experience in a vacuum. You really should like get into the community, post, use the search bar, see what's going on. But
Mhm.
um, when you go through this process and you engage with this prehab, we're not only looking to optimize you physically, we also want to make sure like your mind is in the right place, because there's this day, like, do you think it's day like 4 or 5, where you're just like not right? You're like, I shouldn't have done this, I made a huge mistake, I feel crazy, I want to undo it, take them out. And it's very important to like get back to your why. um, the night before my first surgery, I was like, I think I need to cancel my surgery. I feel like I'm about to do something crazy. Like I'm about to mutilate myself. I'm healthy. Why would I take on
Mhm.
this risk for no reason? That was anxiety. But I wrote a letter to myself sort of outlining like why I was doing this, and not just like, you know, the basics, but like really getting into like why was I actually doing this? I was trying to identify the situations that I felt uncomfortable in that I believe surgery would help me feel more comfortable in. And that's something now that I encourage other women to do, because you have to believe the person that made the decision to have surgery to begin with, and not the version of yourself that now currently doesn't feel well. Um, and so that's like something that we can also go through in health coaching, which is something that we do here at Amelia Health, which is just this one-on-one time where we take the plan that Leah has prescribed to you and we work out how it fits in your life specifically. And it's made to work for you. So if we're getting you ready for surgery, that's something that we're going to think about too. Like, how do we prepare for these days to come, including what we know happens with the mood as well. So that's the only thing I have to add to that. Just really like, how do we take care of all the parts of ourself, including the stress that's part of the stress response.
I love that. I bet if we like did an audit of Bustmob, most of the insane questions and like, oh my God, buyer's remorse happen in those first few days. And I don't think one single one of us have not experienced that.
Yeah.
Like, God, I sobbed for like a half a day, and I should never be making rational decisions when I'm nauseous. You don't know what's gonna come out of my mouth, or like it would be have been cool to have a letter or something like that written back to myself. I think that's really cool. And I just love Bus Mob for that piece of it. But you're right, this even like as I just left my appointment with you guys, because I need the guidance too. Like, how can I get started with Amelia Health, and like how do I weave that into my surgical journey if I'm local, if I'm not local? What does health provide for prehab?
Yeah, fabulous. So we see patients in person and we also see patients virtually, so it's definitely an option. When we are seeing patients before surgery, we're incorporating a few different things. So first of all, every patient, regardless of if you're coming to see us for surgery or not, gets a very in-depth body composition analysis. So we are looking at, you know, and I was thinking about this today because I just did mine again this morning. When you get on the scale at the doctor, like you get one piece of data and it's not in context at all. It's literally just your weight. Even worse if what follows that is just your BMI. Also
Don't
not.
even get me started. They wrote my
Mhm.
I'm pregnant. I'm 32 weeks pregnant and they gave me a BMI. Like, that should be illegal. Like, why are we BMIing pregnant ladies?
Absolutely not.
Like,
Absolutely not.
I'm two humans right now.
Yeah.
Like, actually, like, BMI should be banned, canceled.
BMI canceled. Plain
Yeah. Yeah.
but we are, so you do get on a scale. It looks like a traditional scale, kind of.
Yeah.
But we're also looking at your muscle mass. We're looking at your visceral fat, which is the fat that hides around your organs, that carries more risk with it. We're looking at all of this in context. We're also looking at like where the muscle is on your body. Where is it on your torso? Where is it on your arms? Where is it on your legs? I feel like as women, there should be no other way to get weighed, because it's such a relief to see all of the numbers in context and have someone go through it with you. So that's something that we go through, that you would receive like before surgery, because that's going to tell us how much muscle is on board, how much of that piggy bank do we have to pull from for recovery. Before you even see Leah, she writes an order based off of a call that you and I have where we go over your symptoms, your goals, your medical history. She writes an order for all the labs that she wants run for you, that you get that done at LabCorp, so that when you come in, she has everything in front of you. She's able to see your hormones, your inflammatory markers, your lipids, your blood counts, your electrolytes, your vitamin levels, your micronutrient levels. So she has this really comprehensive overview. And then you go and meet with Leah, and I feel like it's the most in-depth appointment of your life, where she goes through everything from beginning
I'm
to
going to
end
ask you every question you don't want to be
in your
asked.
business.
I'm in your business. Yeah. So, like, sleep, sex, hormone health, gut health. I'm like, I want to know, like, how you poop, what it looks like, how many times you do it. Like, I want to know how many times you have sex with your husband in a week. You know, I want to know all the things. And so we go through all those, like, every body system you can think about, we go through before I even talk to you about your labs, because I like to look at your labs with an eye of like, hey, this is actually what she's told me, not just like, okay, here's the data. Yeah, the data matters, but it also matters how the data is impacting you more than just the data, right?
Yes,
Mhm.
Yeah.
100%. Um, So that's your visit, and then also, then together you sort of like make up this plan,
Yeah.
which she can talk more about. I just want to quickly run through like the other services that we offer that people are coming on to Celia for as well. We do offer IV therapy. Where you're able to come into office and receive like an IV drip, and that can be before surgery or after. Some patients are interested in like, how do I detox from like anesthesia or these medications, or how do I just make sure I'm going into surgery like adequately hydrated, make sure my vitamin levels are where they are supposed to be. We do sometimes see patients who are really interested in having surgery, but their body weight is not where they want it to be, and that could be twofold. One, it can be a safety concern. Like, we want your BMI to be, and I know we hate BMI, but because we are attached to a surgical practice, and BMI is like the gold standard for how they evaluate surgical safety, that is unfortunately the one time we have to like live and die by this number. But we'll see patients who are just looking to reach a goal weight before they have surgery, and so we'll see them for that. And then also sometimes patients are not necessarily that their BMI is too high, but they want to have like an abdominoplasty. They want to have a tummy tuck, but they have this visceral fat. And I'm sure you guys have seen it before, where from the side, the upper part of the tummy has this like pouch, this out pouching. It's like on the upper part of the abs. And a lot of times that is from visceral fat. And so we can optimize what your result ends up looking like while also decreasing your risk long term, by helping you lose that fat that's around your organs, because liposuction cannot get to that.
Right.
And so we have all different modalities, and I'm going to let Leah speak more in depth about those, but these are just some of the things we offer and some of the ways that we help people when they're trying to get ready for surgery.
Yeah. So like Gianna said, so basically we'll get those labs. We'll have a really in-depth appointment. It's an hour-long appointment. I don't know if you've ever seen a physician or a PA for an hour, but it's a pretty long appointment. I'm diving deep. I'm getting in your business. And then we'll make a plan. And that's like a two-way street. And so if you're just like, hey, I want to optimize for surgery, let's say that you have too much weight on you and you do want to get rid of some of that before, I think if you're that person, then about 6 to 9 months in advance would be the optimal time to come see Amelia Health, because that'll give us plenty of time. We do offer GLP, so we do offer peptides, but we don't offer it as a standalone treatment. So I'm going to help you get that weight off, get that visceral fat off, but I'm also going to optimize your nutrition at the same time, because the last thing I want to do is to prepare you for surgery. You go have liposuction and a tummy tuck, and then you're going to gain it right back, because we do know that like so many of us as women like yo-yo with our weight, and so that is typically genetic, that's metabolic. And so getting a surgery and going on a medication is not going to fix that long term. So we're really trying to set you up for success. Those medicines too, also you're not eating as much, so because you're not as hungry, and so your nutrition can suffer because of that. And so really it comes back to the body composition. When we're doing those types of medications, we're really making sure that the weight that you're losing, those pounds are fat pounds and they're not muscle pounds, because it's so much easier for our body to lose muscle than it is to lose fat. And then that's just making our optimization for surgery even worse, because we don't have the muscle that we need. And so yeah, maybe our BMI qualifies us, like it's the magic number, but that doesn't mean that those pounds are like the right pounds, you know? And so really looking back at that body composition. And then there's a few other things, like we'll definitely dive deep into what supplements and vitamins you could take, specifically to help with surgery. But also those vitamins and supplements are going to help with mental clarity, fatigue. They're going to get your nutrients where you need to be. They're going to help with longevity long term. So it's kind of twofold. And then the other thing is other peptides. So what can we do? There's this whole kind of like category. And by the way, peptides, I know it's a word that's thrown around a lot, but basically peptides just mean it's something that's signaling your body to do something else. So when we're taking a peptide, it's just telling our body to do a specific process that our body is already doing. So there are some other peptides that we can use to really help promote healing. And those we're really working with the surgical team to kind of see how we can implement those in some of the surgical patients, to take those either pre-op or post-op or both, to really enhance your healing. So more forming of collagen and elastin, really getting rid of inflammation. And so those are some other kind of like optimization surgery things that we can do.
Gosh, that's a lot. I'm here
It
for
is
it
a
all.
lot. Yeah, it is a lot. But that's why like you need to see someone Like it's a lot. Like if
Yeah.
you were to do it on your own, like you'd be like, what do I do? And like so many of us, I mean, Greta, we had this conversation earlier, but like we're like, okay, we want to take control. And it's like, should we do this or should we do that or should we do this? And I'm the same. Like I'm type A as type A comes. And so
Yeah.
I want to take control and I'll take any supplement that anyone tells me that could possibly make me feel better. But that's where like having this conversation and really taking in like how you're feeling, what your goals are, and
Hmm.
then me giving you like an actual plan to say like, hey, this is like, don't take that, like that's not helping you, this is really
Hmm.
what you should be taking, and really optimizing it so it's such a few things, because again, stress management, we don't want to be overwhelmed either. So
Hmm. Yeah. No, I'm so like between Gianna's letter to yourself and almost even now I'm like envisioning like an inspiration board. And then had I dug into nutrition and fitness a little bit more ahead of time, I don't know, it would have been like you're getting excited while you're recovering,
right,
scrolling and looking at bikinis and adding things to your like I don't know, I get all like the first of the year or doing something big is always like a good time to make changes, in your life too.
right.
And so I think this is really a positive thing to be talking about. Chelsea just asked, what type of magnesium do you recommend?
Magnesium glycinate is what I
Okay.
recommend. Yeah,
Okay.
magnesium glycinate, because it works on the brain, to help with the stress management and the sleep
Uh-huh.
portion, but it also helps you poop a little bit. But it's
Yeah.
not going to help you poop as much as like magnesium oxide or magnesium citrate are going to, where you're going to take it and you're going to like have diarrhea for the next 24 hours. So it's kind of that sweet spot magnesium. And so that's my preferred.
Yeah, that would be awful to have the wrong kind after
Right.
surgery,
Right.
for sure. Is there anything that you would definitely say though avoid
Yeah,
doing
so
ahead of
anything,
time?
so always consult with your surgical team, because it's going to be kind of dependent on like what surgery you're getting.
Hmm.
And like your anesthesia and all of that is going to play a role, but the surgery team is really good about telling you like what you need to stop and when you need to stop it. Primarily the things that are going to be a big no-no are anything that's going to thin your blood or increase your risk for bleeding. And so although omegas are actually really anti-inflammatory and healing, they're still technically on the no list for
Hmm.
pre-op. So things like NSAIDs, omegas, anything that's going to thin your vitamin E, anything that's really going to thin your blood will be a no leading up to surgery.
Hmm.
But the surgical team does provide you with a list of those.
Hmm.
And then obviously, if you're seeing us, we'll work in what we're doing with their list and make sure that you're stopping and starting things appropriately so that you have the best experience.
Hmm. What about like electrolytes and things like that? Do you recommend
Yeah,
those?
that's a great question. I personally love electrolytes. I'm just not a great water drinker in general. And I do think
Hmm.
to get your cells hydrated, you need those electrolytes. You can't get water into your cells without salt. Um, but to be honest with you, like there's not a lot of studies that say that electrolytes help pre-surgery. Like there's not data there, and whether that's because studies haven't been done or not. But personally, yes, for my patients, I am a fan of electrolytes just because I think that it hydrates you faster.
Hmm.
Yeah.
How
And then
about
the pre
since
op IVs too.
Yeah, that I think is really cool. I'm
Yeah.
like stick a needle and do it all so I don't have to take a bunch of pills.
Right.
You and I were talking about diet types earlier too. What about like a low carb diet before surgery? Do you think people should add some carbs in before and after surgery?
Yeah, I think again, like the research is mostly like protein based as far as like what
Hmm.
matters the most for healing. But I am not a no carb girly in general. So
Hmm.
I think that carbohydrates are a preferred source of energy for our bodies. They're what our body wants to use and burn. And so
Hmm.
if you're eating no carbs, unless your body is like seriously used to that and you're staying in a ketogenic state
Hmm.
long term, which you're probably not going to be able to do post surgery, it
Hmm.
is better to do some carbs. And there are some studies that say that like pre surgery carb loading can
Hmm.
help with healing. I'm not telling everyone to go out and eat like a
Hmm.
bunch of of cookies and cupcakes pre surgery. But yeah, I do think that carbs are helpful.
The big pasta meal that we did before our marathons, like go
Yeah,
out and eat that big, huge
yeah,
meal beforehand.
yeah.
Gianna, with your surgery experience too, personally, is there anything else you want to add of do's and don'ts or wish you did, or when it comes to prehab?
It wasn't, it doesn't apply to me, but smoking,
Hmm.
not only is it really difficult to quit, but there's like a lot of shame around quitting. And
Hmm.
primarily what's available to quit is more nicotine, like nicotine patches. And when you're getting ready for surgery, like you can't use any form of nicotine. And I think something that's unique that we could also help with here is helping patients quit smoking. There's
Mm,
lots of other like options and modalities, pharmaceutical and non, that can be really helpful. Even like microdosing GLPs have been really helpful for
mhm,
people in helping them like reduce the craving to smoke, as well as like some medications as well. So I think like for people who are interested in having surgery, but they're like, I can't imagine being successful at quitting smoking. Coming in and allowing us to help can be really life changing, not just so that you can get surgery, but also just for like the years ahead, being able to
mhm,
successfully quit
Right.
smoking. And then also, I see a lot of people who are like me, they're planners and they want to like nest and get ready for surgery. And you end up with a lot of like snacky things that tend to be very like processed.
Hmm.
mhm,
And sugar hides in a lot of different ways, in a lot of different places, in different forms. So, if you feel overwhelmed by evaluating like a nutritional label, I think that alone is a good reason to seek care and
mhm,
help get a team around you that can really help you come up with a nutritional plan that's going to not be pro-inflammatory when you're already in this inflamed state. Like Leah said, inflammation is important. It's how we heal. It's how our body signals itself to heal. But there's too much. There could be too much of a good thing, and things that promote that further we want to avoid. So I think that I had a good handle on my nutrition post-op, and I think in my most recent surgery that finding ways to work in protein, like I ended up just drinking a lot of protein, and that
mhm,
helped me a lot because it was really hard to eat. So I think if you're a smoker, avoiding smoking, you have to stop smoking. And it's not just about smoking, like stopping smoking in the days before surgery. We know that for our bodies to heal from what smoking does to us, we actually need like 6 weeks before surgery. Longer is
mhm,
better though. And then abstaining from smoking after. And then using this time as like a jumping off point to the next version of you, I think is really powerful.
mhm,
Greta used to say this to me,
mhm,
like before I was even a patient at Amelia, I used to say, like, I can't explain it, but there's like something magical about having plastic surgery. And we sound
mhm,
crazy, and then you say it and you experience it. And it's true. It's just true. I don't know. It's true. This is like prime time for
mhm,
you to pivot, because for most of us, it's this time in our life where you're like really, really, really just choosing yourself.
mhm,
You have to. You have downtime to heal. You can't do all the things that you were doing. And it's for whatever your reason is, it's a very valid reason. And it's a very intentional expression of care for yourself when you make this
mhm,
decision. So I think seeing it as the really empowering decision that it is can be really like it's a game changer for a lot of women. So
mhm.
I'm excited for anyone who pursues this, um, and just so grateful for the opportunity to possibly be part, of their journey.
Well said. I love it. It's like you're doing a physical rebirth. You
Hmm.
might as well do an emotional and mental like rebirth while you're in this season of downtime.
Yeah.
Like I love that so much. Obviously, you're talking my
Yeah,
jam.
like the
Like,
outside and the inside, like you're
yeah.
this physical recovery, like what a great opportunity to also really like get into it with someone like Leah who can look at the big picture and make sure that even like down to a cellular level that you are truly optimized.
Hmm. How can people get started or find out more?
Yeah, so if you go to askamelia.com/health, there's all kinds of information on that landing page. There's a little bit about what you can expect as a patient, sort of the patient journey. And then there's also a link to get started, and it's like a type form where you actually will put in your information. Tell us a little bit about yourself, what you're interested in, how I can get in touch with you, and then we'll reach out to you. And from there, it goes to an onboarding call that we'll schedule for
Hmm.
you, and it's very brief. It's like a 15-minute call
Hmm.
with me, and we'll sort of go over what you have going on. I'll send you some paperwork that truly takes about 5 minutes to fill out. And then from there, we'll get you to Leah.
It's so cool. You gay ladies are wonderful. Thank you for especially the Christmas Eve giving
Yeah.
your time where you're here seeing patients too, which is wild. So thank you from all of the Bus
Thank
Mob
you.
community. I know people will have gotten nuggets out of this. I know I did. Now I need to go have some more surgery so I can put them into practice and prove that it's true. Obviously I will be doing that. But yeah, thank you so much. And I love this community and grateful for you guys being a part of it.
Yeah, thank you so much for having us. I'm so excited to some people I've already seen some patients who are already getting ready for surgery. So I'm excited to see more.
Yeah.
Um,
Thanks
yeah,
so
and
much.
just get feedback, like how this helps people recover, especially people who've had surgery before and then
Yeah.
go through this with like more of that prehab in mind and kind of seeing how their experience goes. I think that'd be great. Greta, you're a great person to do that with.
Yeah, we
So
should post some questions too in Bustmob, just asking what people have done, what has worked, just
right,
seeing like, because I think this is like the next evolution of we're helping people find good surgeons and know how to own their consultation process, but now it's like now how to own their health leading
right,
up to it as well. So
right.
it's an
That's
important
so helpful.
conversation.
Yeah.
Yeah. Thank you
So
guys.
have a great
Thank you.
holiday. See you guys
Yes.
soon. Bye, everybody.
Bye.